I have no.
She's
Oh,
like,
okay, that's right.
it reminds me of an ice cream cone.
Oh. All right, we ready?
Yep.
What time is it?
11
I
o'clock.
think it's exactly 11. Alright, so take it away.
Hi everybody, my name is Amie Miller. I'm a nurse practitioner here at Sarasota Memorial Hospital. I work with lung cancer screening and prevention, and I want to welcome everybody today to the Great American Smokeout. Today, we're really lucky to have a couple of our community experts here on smoking cessation and tobacco dependence. So sitting next to me is Hailey Shaughnessy. She's a licensed mental health counselor. She works for our Gulf Coast AHEC, our Area Health Education Council, and they're the program that provides in-person smoking cessation counseling. And then I also have Dr. Kirk Voelker here. He is a local pulmonologist who's also one of our critical care specialists, and he has been a champion for smoking cessation for over a decade in our Sarasota County area. So we just want to spend the day today really talking about smoking cessation and wanting to offer you the opportunity to ask our panel experts questions and really get you motivated and in the spirit of quitting smoking. Smoking is the #1 cause of preventable death. Over 480,000 people a year perish related to smoking-related diseases, and it is the #1 cause of lung cancer, so obviously a big focus for me and my team in helping anybody who's wanting to quit make a quit attempt. So just going to start off, also just want to remind everybody that if you have a desire to enter a question, we're certainly willing to take those at any time. You can enter them right into Facebook. Also too want to point out on the back of the screen here, we have some smoking cessation resources listed for you. So the Gulf Coast AHEC website is there, along with the Tobacco Free Florida website as well. So just going to start off, I'm going to start off with Dr. Voelker and just sort of ask him some questions about really the harms of smoking and what does that mean when you are smoking and how does that affect your body on a day-to-day basis?
All right, well, starting off with the harms of smoking. The funny thing is that this is the least likely thing to get people to quit smoking. Because today is the Great American Smokeout, and we're supposed to be encouraging people to at least be considering how you're going to quit smoking. There's this powerful smoker's denial that bad things are going to happen to other people. Of course, until it happens to them. So, the harms of your body, if you think about it, you've got this cigarette, you light it on fire, you're inhaling these poisonous fumes. There are up to 6,000 different chemicals in a drag of a cigarette, okay? 60 of them are cancer-causing. So just starting out with that, you know this stuff can't be good for you. So going down into the respiratory system, okay, it irritates the bronchial tubes, it can worsen asthma, cause emphysema. Now, emphysema is like if your lung was a sponge, it has these fragile little alveoli, air sacs. And if your lung is a sponge, it's like pouring acid on it. And it actually eats holes into the lung. Once that tissue is destroyed, it's gone. Now, God gives you twice as much lung as you really need. So you can actually dissolve through 50% of your lung tissue before you start feeling it. And that's why, some people, by the time they start feeling it, it's almost too late. Now, getting back to the lungs, of course, lung cancer is caused by smoking. Over 85% of lung cancers is directly attributable to smoking. Smoking also accelerates heart disease, vascular disease, high blood pressure, strokes, heart attacks. The cancers, anything that the smoke touches or the smoke byproducts touch will be exposed to cancer. So if you think about it, you inhale it into your lungs, your posterior pharynx, your throat, your lungs, all are at risk. But so is your esophagus, your digestive system. It gets excreted out your kidneys, so you're at risk for kidney cancer, bladder cancer, as well as increased risk of other cancers such as lymphoma and breast cancer, pancreatic cancer, all just because of smoking.
Yeah, so recently I actually was looking on the CDC website, And I saw a comment on there that said that if nobody smoked, that our lung cancer deaths would be cut by a third. So 1 out of 3 people that currently die related to a smoking-related cancer, that would be the case if nobody smoked. So I thought that was an interesting statistic.
So I would think that we're talking about cancer in general. Rates, not just lung cancer.
Not just lung cancer,
okay.
general.
Right, because 85% of lung cancers are caused by smoking.
Right.
So if nobody smoked, it would be cut by,
True.
Yeah.
True.
All right.
So do you want to spend a little bit of time talking about why we're here today? Great American Smokeout, really wanting to try to get people motivated, encouraged to take this first step into making an attempt to quit smoking.
I'll hand that off to Hailey.
So most smokers, as you said, know that it's not healthy. It's not good for you. I think some people don't realize how bad it is for you, though. Just like the list of things you just named off. You did throw in there type 2 diabetes. So it's like, people really? Type 2 diabetes? I mean, it's amazing how much it affects you. But most people do want to quit. And we see that about 70% of smokers say, when asked, that they really would like to quit. Maybe they've tried before and they weren't successful and they've kind of given up. But every year, a large percentage of smokers give it another try. It can take up to 14 quit attempts, and for some people maybe more, but on average 14 for people to actually quit. And so that's what we offer, the classes that we have as part of the Tobacco Free Florida program. So we have classes here at SMH every month, but we also offer them at the health departments and a wide variety of other places in our 4 counties. And that would be Manatee, Sarasota, Charlotte, and DeSoto. So if you call or contact us from the information up there, you can not only see a calendar of classes online, but you can also come in for one of the classes. And you get that group support, and you get someone like me, who's also a certified tobacco treatment specialist, like Amie is, that can really talk about, some of the best tools to help you quit smoking, and you get free nicotine replacement therapy as well.
So what do you say when people say to you, I've tried so many times to quit and I just failed, and I just don't think I can do it?
It's interesting because if they're talking to me, then it means they haven't completely given up. Right? If they completely had given up, they wouldn't even be calling. So if they're on the phone with me and they say, I've tried before, I try to tell them, well, what did you try before? And maybe they say, well, I tried cold turkey. And after a day, I just couldn't take it anymore. Or my family said I was too cranky and bought me cigarettes, which is horrifying. But I'll say, well, have you tried the nicotine replacement therapy? Have you tried coming in and getting some group support? Maybe it would be different this time. And we're happy for you to come in, and we're happy to, talk about, what it is that will help make you successful. So, doctors maybe actually get people, or you may get people who are really in that pre-contemplation stage. They're not ready. I always get them a little easier at least the contemplation stage.
I've got some additional insight on that. And, Hailey, you're absolutely right in that, I think it was Rocky, that it's not how many times you get knocked down, it's how many times you get back up.
Right.
So, you have to realize, even if you tried quitting a half a dozen times, it may have not been with the appropriate support. And either pharmacological support, drugs such as, Wellbutrin, Chantix, or nicotine replacement, or you didn't seek counseling, you didn't ask for help. Just by merely asking, going to AHEC and asking for help, your chances of quitting are increased by 50%. By taking a medication, they're increased by another 50%. So why not give it your best shot? And a lot of this I've found is getting your head in the right place as you do it. If you just stop smoking and say, I'm just not going to smoke, I'm going to use willpower, sooner or later, that willpower is going to get out. You're going to have that one cigarette. And once you have that one cigarette, it's like almost like an alcoholic with a drink. It triggers that addiction center, and then you're gone. We always say that you're one puff away from a pack a day. So it's about getting your head in the right space before you quit, and that's best done with somebody who will help you do that. And then planning on using an appropriate medication.
Can you talk a little bit more about the medications that are approved for smoking cessation, particularly the Chantix or the bupropion or Wellbutrin?
There's two medications, two pills, I should say, that are approved for smoking cessation. One is Wellbutrin, or Zyban is the trade name. And it was actually started out as a antidepressant drug, and they found that their patients were quitting smoking. The other one is called Chantix, which is a pill that you take once a day. And that is very successful. It will increase your success rate, again, by 50% if you use that. Now, the problem is most people go into this thinking that the medication, whether it's nicotine replacement, Chantix, or Wellbutrin, that is going to make the difference. That's going to do the heavy lifting. No, that's going to take the edge off. It is really up to you to do that heavy lifting and really be able to walk away from this. It's addiction therapy. It's like, not until your head is ready to walk away from this whole thing can you actually say, I'm done, and walk away. Otherwise, it's going to be, you're deprived of something. And if you go into this thinking that you're deprived, you're always going to be deprived. This is your choice. And today on the Great American Smokeout, we are encouraging you to take the first step in that.
And so that's a good point. Maybe Hailey can talk a little bit more about sort of the psychological dependence, the habit that's tied with smoking, and how people can really overcome the habitual aspect of smoking.
I was talking to a group of providers actually yesterday, and one of the people said, well, tobacco isn't a mind-altering substance, so it's not really all that bad, right? And there was an ARNP in the room who said, it is still a mind-altering substance. And so, he's like, well, you could get behind the wheel of a car, though, and drive with it. Well, yes, you could. It's not going to cause hallucinogens, or you're not going to pass out behind the wheel. But it does alter the mind. And I think we have this false concept, like, it's just cigarettes. These drugs are really bad for you, and the nicotine in the cigarettes are a lesser thing. But we do know that it hits all the neurotransmitters in the brain. So norepinephrine, acetylcholine, GABA, beta endorphins, serotonin. It lights up the whole brain. I used to be a counselor for people who were felons that had gotten out of jail, and they were trying treatment with them, and they would come for treatment. For drug addiction. And all my people had co-occurring disorders. So they had anxiety, or they had depression, or they had schizophrenia, or some other issue. And they would tell me that they thought the most addictive substance they had ever taken was nicotine. I was able to quit the heroin, one of my clients said, and I just don't seem to be able to quit the nicotine. So it really is an extremely powerful addiction. And I think that, for people to say, well, you should be able to quit. Just quit. What's wrong with you? It's bad for you. It takes a lot of support. It really does. And really trying to understand that this is a difficult thing to overcome from a psychological standpoint.
And so that's why we're here today. We want to, really offer you the support and the help that you need to make that attempt to quit smoking. Again, we have resources on the wall in the back of us here, how to contact AHEC, how to contact the Tobacco Free Florida website. Quitting smoking is the #1 most important thing that you can do to improve your health. And here at Sarasota Memorial Hospital, we want to help you accomplish that goal. So I think that we have a question from one of our online watchers. So
the question is, what do you think about e-cigarettes? Are they a good tool to help you quit smoking?
Okay, so the question is about electronic cigarettes, and I'm going to let Dr. Voelker talk about this a little bit. Really, they want the viewer is asking, is it a good way to help quit smoking?
Okay, so electronic cigarettes are basically nicotine that's vaporized, and you inhale it just like you inhale the smoke. They are not regulated. So we're not certain exactly, what is the substance in there. When you heat up the substances, there are volatile organic chemicals, VOCs, that are inhaled that go into your lungs. And, it may not have the 60 cancer-causing agents, but let's say it's got 6 of them. Is that any better?
Do you want just a little lead in your water?
Yeah,
or
exactly. Yeah. How much poison do you want? We do use inhaled nicotine as part of a therapy to help quit smoking. It's called a Nicotrol inhaler. Now that's been through FDA testing, whereas the electronic cigarettes have not been through the FDA testing, and so physicians generally do not recommend them as a smoking cessation aid. But there are currently ongoing trials looking at them at that. We just don't really know the long-term consequences. We didn't know the long-term consequences about smoking until it was, 3-4 decades down the road.
So what you're saying is that we may not know how harmful electronic cigarettes are for 10, 15, 20, 30 years. Do you have any comments, Hailey, about electronic cigarettes?
No, what we find, someone asked me just Tuesday night, I was here doing a class, and one woman said, what about electronic cigarettes? And I said, well, what we tend to find is that instead of helping people quit, they do dual use. And one of the women just started grinning really broadly, and she said, yeah, that's what she ended up doing. She got an electronic cigarette, and I was like, oh, I'm at a comedy club. I can't smoke in here, but I can use the e-cig. So they start using even more nicotine or getting even more chemicals into their system, where maybe there are places that they wouldn't have been smoking at all. And it looks like we have another question.
We do. We have 2 more questions. One is, are the prescription drugs that you're talking about for quitting smoking covered by most insurances?
So the question from the viewer is asking about insurance coverage for medications, and I can let Dr. Voelker answer that.
Can you answer? Do you know?
Well, I guess basically from my perspective, it just really depends on the patient, the specific plan that you have. More and more insurance companies are covering these medications. Chantix typically was a very expensive medication to buy, but recently I had a patient that came in through our lung screening program that said that her insurance company covered it at a very little out-of-pocket expense. So I think that they're starting to recognize that, hey, if we can help people quit smoking, then obviously on the back end we're going to have fewer healthcare related costs because the patients are not smoking anymore. So that's been my experience.
Yeah, I concur with that.
Okay. And they're very effective medications. That I have people that come in and meet with me on a regular basis and ask me about the medications for smoking. The clinical guidelines for treating tobacco dependence say that anybody who wants to make a quit attempt should be offered a medication. So I have a lot of people that really want to be very stoic and really want to try to go at it cold turkey, and it's all about willpower. But really, the studies have shown that if you're willing to take a medication, that your chances of being successful are much, much increased, up to a 50% more success rate. So it's really important to consider that. I understand that it's not necessarily for everybody. However, I do try to really encourage anybody who wants to make a quit attempt to talk to their provider about getting a prescription medication or using the nicotine replacement therapy. So again, very effective methods in helping people quit smoking. So
we
have another question.
We have 2 more questions. Can you get the medications to quit from your general doctor, or do you need to see a specialist to get those prescriptions?
Yes, so you should be able to get those medications from your regular family doctor, your general provider. Having a conversation with them is very important. Not all of the medications are for everybody. For instance, Wellbutrin or Zyban, like Dr. Voelker talked about earlier, isn't necessarily the right medication for anybody who has any sort of seizure activity disorders or any sort of eating disorders. So really having some frank conversations with your provider, being very honest with them, and making sure that they're making the right choice for you is important.
And the other thing to remember is that, again, just because you're getting the medication does not mean that it's going to make you quit smoking. It's not going to make you do anything. This is your journey. And unfortunately, as physicians, we're often too busy to be able to adequately counsel our patients. And that's why it's right, something like AHEC, where you can go for, group sessions and have somebody take a real interest in your quitting process.
And I will say, we will also take questions from people. Like, they will call in, and we try to give them that extra support. So I had one gentleman who actually took the class here at SMH. He called me every week, tell me, what symptoms he was feeling from the nicotine replacement therapy and how he was doing, if he had cravings and that sort of thing. So we are willing to help out. I also encourage people to look if they have like an EAP or something like that through their insurance, where they can get some additional counseling. So definitely counseling is a huge part of it, and just, really being determined and wanting it for yourself.
Yeah, I mean, what I oftentimes tell people when I'm counseling them on smoking cessation is that you really have to figure out a plan. If you don't have a roadmap about how you're going to get from point A to Z, it's really going to be hard for you to be successful. So AHEC in the class, they actually have these tools to quit classes where they will help you develop a quit plan step by step by step. And I think it's very important to be able to have that plan established, because you're going to need to know what to do when you're faced with a trigger, or when you're stressed out and you're wanting to reach for a cigarette. What is it that you're going to do instead of reaching for a cigarette? What healthy activity are you going to replace the smoking with? And so having a plan is really, really important, and that's where the counseling comes in. That's where the in-person classes come in that help you formulate that plan to quit. So like Dr. Voelker said, taking a pill isn't just this magic bullet that's going to help you quit. You have to really have, the behavioral counseling, changing your habits, and making sure that this is a plan that you're moving towards rather than just taking a pill. It's got to be dual aspects.
And then the other question is, can you take Chantix or Wellbutrin while pregnant?
I'm going to let so the question is that can you take Chantix or Wellbutrin while pregnant? And I'm also going to add in there, can you take nicotine replacement therapy or Wellbutrin or Chantix while you're pregnant? So I'm going to let him answer that.
In general, a nicotine replacement therapy is safe while you're pregnant. Wellbutrin and Chantix are, I think, category B, which means that you need to talk to your doctor about. Okay, and everybody is different on that. We have had pregnant people on both those medications, but it is an individual decision.
Sorry, a couple more questions, if you don't mind.
No, sure.
How long after you quit smoking will your lungs return to normal?
Okay, so the question is, how long after you quit will your lungs return to normal? So I'll let Dr. Voelker answer that question.
All right. So I'm actually going to use that question to segue into all the good stuff that happens to you when you quit smoking, because that's what we're here for. We're here to encourage people to quit smoking. And so what's the benefit on the long run, okay? So as soon as you quit smoking, within hours, the carbon monoxide, which sort of strangles your blood cells and holds on to oxygen so the rest of your body doesn't get it, that decreases, and your body gets more oxygen. All right, within the first day, your blood pressure goes down, your vessels start to spasm less, making you at a little bit less risk for a heart attack and stroke. 2-3 days down the road, what happens is that you start getting a little bit of your taste back. Your first week or so, your lungs start to heal. You start the ciliary little hairs in your lungs that clear mucus start waking up and working because the smoke paralyzes them. So you may find that you're coughing up more junk, the week after you quit smoking. And your lungs continue to sort of repair themselves and clean themselves out for the next several months. Now, the caveat there is the damage that's done with emphysema that I was mentioning dissolves your lungs. Once your lungs are dissolved, they're not getting better. So that part doesn't get better, but the bronchial tubes, clearing out secretions, that gets better. As you go on, after a year, your risk of heart attack is now half of what it was. At 10 years, your risk of lung cancer is half of what it was. And at 20 years, your risk of a heart attack is that of a person who never smoked. All right, so that is all the good stuff you can look forward to when you quit smoking.
So I oftentimes have people come to me and say, I'm 70 some odd years old, I've been smoking for 60 years of my life, it's just, why bother quitting now? So what would you say to a patient like that?
At any age, there is a benefit at quitting smoking. If you ask somebody, and unfortunately I've had the opportunity to ask people who are in the process of actively dying from smoking-related disease, would another 6 months make a difference to you? And yes, it would. And when you think about how we treat cancer, you know, we will give chemotherapy, we will fight this cancer just about another 3 or 6 months. Well, if you're, you know, 75, 80 years old, you can still buy yourself 6 months by quitting smoking.
So I'm going to ask Hailey a couple questions about withdrawal symptoms, because I think that, you know, a lot of times people go into the idea of quitting smoking fearful. Oftentimes I have conversations with people about quitting smoking, and the minute that I mention it, you can see anxiety goes out the roof, that people get very fearful. I've even had some people break down and cry over the thought of quitting smoking. And so, you know, I want Hailey to sort of address, you know, what's the basis of those fears and what we can do to help you.
Yeah, it's interesting. We had a gentleman here at SMH class again came in, and he said he actually got a ride here because he was afraid if he got behind the wheel himself, he would just drive the opposite direction. So there is a lot of anxiety around smoking. Your last class, where I was downstairs, I saw people pull up 30 minutes before the class, but they were sitting out in their cars smoking cigarettes. Like, oh my goodness, she's going to wrestle us to the ground and take our cigarettes away. Smoke as many as you can beforehand. So there is a lot of anxiety around quitting. If you did it cold turkey, yes, there's withdrawal symptoms, and you don't feel good. But if you use the nicotine replacement therapy or medication, you won't necessarily have withdrawal symptoms. So if you're using it properly.
What are the common withdrawal symptoms?
Irritability. You definitely, you're not getting those neurotransmitters. So one of them would be dopamine. That's the pleasure reward, and you feel good. Serotonin makes you feel relaxed. A lot of people say they smoke because of anxiety. So even the fear, not of withdrawing from the tobacco, but how do I handle anxiety without tobacco? That's the thing I've been doing. However, it also floods your body with norepinephrine, which is adrenaline. It raises your blood pressure. So a lot of people give the cigarette a lot of credit for reducing anxiety when people who smoke have higher instances of anxiety. And studies have shown actually that anxiety is greatly reduced within 6 weeks of quitting. So we like to give them a lot of tools for how to handle anxiety, healthier, better ways than smoking. But yeah, you will maybe see people who also, as far as symptoms, maybe a little jittery, shaky. But yeah, it's withdrawing from a drug. So.
How long would somebody expect to have withdrawal symptoms like that?
I think that's an individual thing. I've had some people who say, you know what, I'm doing this couple series of like the 6-week class, and I've got one guy who hasn't smoked in 2 months now, and he's hardly been using the nicotine replacement therapy. I have another woman who just used it for like the first couple weeks, and she's fine. Other people are still on the nicotine replacement therapy, and they've extended how long they're doing that. So it's really being patient with yourself and understanding. I think different people are addicted at different levels. How long have you been smoking? The 2-pack-a-day smoker compared to the half-a-pack-a-day smoker are probably going to have different symptoms and experience things differently.
And so, going on further on that, is that the addiction of tobacco or nicotine is multifold. Okay, so first of all, you've got the chemical addiction. All right, so you're withdrawing from the chemical, which Hailey just mentioned. But it's also a habit. It's something you've been doing, 10 times a day for the last 20, 30 years. You wake up in the morning, you have your cigarette, you have coffee, you read the paper. And so there's withdrawing from the habit. And then there's the psychological addiction of being deprived of something. And so all these things need to be addressed. And one of the things I do for my patients before they quit smoking is saying, look, I want you to uncouple the habit part from the physical withdrawal. And so I no longer want you to smoke in the usual situations. So when you get up in the morning and have your coffee, you can't smoke for 15 minutes after your coffee. You can't sit in your favorite chair and have your coffee. If you are in your car and want a cigarette, you can stop the car, you can smoke a whole pack, I don't care, but you just can't smoke in the car. And if you do that 20, 25 times before you actually quit, it makes that habit part so much easier. But also I want to just reinforce this, that you know, once people quit and they get that urge, and it might be 6 months down the road when the physical withdrawal is no longer anywhere a part of that. If they have that one cigarette, it lights up that addiction center, you know, bathes their drugs in these feel-good chemicals, bathes their mind in these feel-good chemicals, and, you know, you're back to smoking. You're that one puff away from the back of it.
Do we have another question?
Is hypnosis an effective quitting tool?
So the question is about hypnosis, and we could also add in there other alternative therapies, things like acupuncture. And so I, as a nurse practitioner, my focus is always on what the clinical evidence proves. And the clinical evidence doesn't strongly support the alternative therapies such as hypnosis or acupuncture. However, I always tell my patients that quitting smoking is an individual approach. It's oftentimes a multi-pronged approach. And so sometimes you need to have more than one therapy when you're looking at quitting smoking. And if acupuncture or hypnosis helps you along that journey, then absolutely, I certainly encourage that. But I also strongly encourage all the mechanisms that are proven to be effective, things like nicotine replacement therapy, behavioral counseling, and other pharmacotherapy like the Wellbutrin or the Chantix. So that's sort of the perspective from me. I've had many patients that have come in and have sat in front of me and have said that hypnosis worked for them. I've had many more people say that hypnosis did not work for them. So it just really is an individualized approach, and I can either let Hailey or Dr. Voelker comment more on that.
Interestingly enough, I'm trained in hypnotherapy, and I know it's not appropriate for all people. And I think a lot of people look at it as like this magic bullet. And I'll get people in class going, can someone just put me under, and then when I wake up, I'm done with, you know, wanting to smoke. And it takes the work. It takes wanting it. And we have people call us and say, hypnotherapy worked for me 10 years ago. I had smoked, and then all of a sudden I picked it up again. I read a study a few months back that said hypnotherapy seems to wear off. For whatever it is, for trauma, for smoking, whatever it was, and you may need to go back to, you know, another session, or you still need to be aware. So my concern with hypnosis is that if, let's say it really worked on someone, they really wanted it. I had a guy that I worked with named Bill that his wife was wanting him to do hypnotherapy. He didn't really want to quit smoking, and he didn't really want to do the hypnotherapy. He said he walked out to the parking lot and lit up. So it's something you have to want first for it to work. But even if it did work for you, you didn't address the behaviors that Dr. Voelker was just talking about. You didn't address the emotional issues associated with it. So when it wears off, what happens? You know, now you didn't really figure out a better way to handle anxiety other than smoking, and you may pick up a cigarette again.
So I would like to echo that too. This is your journey. Okay, so my personal approach to it is that whatever way you want to do it, if you think that standing on your head whenever you want a cigarette is the way to quit, that's okay. But I would suggest that you reach out for help and have somebody help you through the process. So when things get really tough, you've got somebody to talk to, you know. And so if somebody comes to me and says, I want to try hypnosis, I want to try acupuncture, I'm like, okay, go for it, but let's set up a structured program while you're doing it, so you have some support.
Right, exactly. Yeah, I mean, I want to just talk a little bit about the emotional aspect related to smoking. You know, I have a very good friend, and one time she said to me, you know, Amie, you don't know, when you ask me to quit smoking, it's like you're asking me to give up my best friend. And when she put it to me in those terms, it really made me understand how powerful this addiction is and how much people are emotionally tied to their cigarettes. You know, when I was going through my tobacco treatment specialist training, we saw a clip of an actress, and, you know, she lived a life on the road. She was very lonely in a lot of ways, and she said that in her pack of cigarettes, she had 20 of her best friends. And, you know, it's just really, I think for those of us that don't smoke, we don't necessarily understand some of the emotional companionship that cigarettes and smoking provide to people. And so I want to sort of address that a little bit and see if Hailey or Dr. Voelker have any advice on, you know, sort of how do you sort of cut that emotional connection?
I've actually had many of my patients say that to me, that I feel like, you know, my cigarettes are my best friend, you know, but I tell them that it's like that best friend that's really stabbing you in the back, because your best friend here is killing you, you know, and you're letting it. But that is another reason that it is good to go to counseling, AHEC, a program where you have other people that you can commiserate with and say, oh, this is really tough. Back when I had my smoking-cessation program, every Thursday night we would have a group phone call that everybody would get on the phone, and I would encourage people who had quit and been successful for 6 months, a year or so, to come back on so they could talk to the people who are just quitting now, and they can say, oh yeah, I remember week number one, boy, that was tough for me too, but hang in there for a couple more days and you can get through it. So my suggestion is to not think of cigarettes as your best friend, but go find a best friend, okay? And have them help you through this process.
Yeah, I did have a gentleman once who said to me, and it gave me chills, you don't understand. My parents are gone, my siblings are gone, my wife is gone. Smoking has been with me longer than anyone. And I said, yeah, it may be your longest relationship, but it's a super unhealthy relationship. If someone came to me for counseling and they were in a domestic violence situation, like, this is not a healthy relationship. That's what smoking is like. So yeah, it is recognizing for what it is. And one of the exercises that I find kind of helpful is writing a goodbye letter. We used to do this with other drugs, write a goodbye letter to your drug of choice. So write a goodbye letter to nicotine. Really allow yourself the grieving process of letting go of this relationship. So, hey, nicotine, you've been with me, good times and bad, but you're killing me. And here's the reasons why I'm letting you go. And I think some people find actually writing that letter is kind of a helpful exercise.
So I have, just a couple of questions about relapse. So we know that nicotine dependence is a chronic condition that's really characterized by periods of abstinence with relapse. And so many former smokers often go back. I have so many people that sit in front of me on a day-to-day basis that say, I've tried quitting, 10 times, 20 times, 100 times. And, they have a real hard time with the relapse and end up going back. So I guess I just want to ask Hailey and Dr. Voelker, what kind of advice do you have for people when they have relapsed? And how do you approach that?
Well, first, we don't always call it a relapse. I had a gentleman call me once and he said, oh my goodness, I hadn't smoked for a month and I was at this barbecue and I had a beer and then I had a second. And next thing I knew, I was bumming a cigarette. So alcohol really does lower your inhibitions. And I said, so did you go buy a pack? And he said, no. And I said, okay, so let's just call this a slip. Okay. You had a slip, not a relapse. So one cigarette, you're really sorry you smoked the cigarette. Let's look at what led up to you having that cigarette. Oh, okay, well, the alcohol and being around other people who are smoking. So maybe until you feel more secure, don't have a second beer or don't be around, people who are smoking. So it's not always, full-blown relapse. When people actually relapse, have gone out, that puff led to the pack, then it's, come back to another class. You can take the class twice in our fiscal year, which starts July 1. And so just come back in and we'll get you started again on the nicotine replacement therapy. So you fall off the horse, you get back on, you just keep going. So that's one of the things, with relapse. Any comments?
Yeah, I think you're once again spot on with that, is that I consider it a slip and a fall. Okay? So if you had a slip, you had a cigarette or two or 5 or whatever, the thing is to reach out and, call AHEC or whoever you've trained with, your support person, or if it's your best friend, whatever, and realize that you are on this very slippery slope and you have to stop now immediately because it's only getting harder later on. If you've gone back to smoking, buck up, realize it, go back and quit again, the sooner rather than later. Because the longer you go on with this, the harder it is to quit again, the more of a real addiction it is.
Yeah. So again, I just want to just bring everybody's attention to the references on the back of the wall here. Today is the Great American Smokeout. We want to be here today to help you make those first steps towards making a quit attempt. Obviously, we have Gulf Coast AHEC. They are the local providers that provide the in-person group counseling and the free nicotine replacement therapy. So if you sign up for a class you actually will be provided upon the day of the class with your free nicotine replacement therapy. That's dual therapy, the patch plus gum or lozenge, depending on how much you're currently smoking. Also, too, some great resources are the Tobacco Free Florida website. They have a Quit Your Way plan, and it really helps individualize the approach to quitting smoking that will best tailor your lifestyle. Again, this is also to National Lung Cancer Awareness Month. November is not National Lung Cancer Awareness Month, and so as part of that, we are also promoting lung cancer prevention, which obviously, smoking is the #1 cause of lung cancer, and also to early detection. So here at SMH, we have a screening program to help detect lung cancers at earlier stages. If you want to view into SNN today, there are going to be ongoing periods where Dr. Joe Seaman, our pulmonologist, medical director for the lung cancer screening program, is going to be talking about lung cancer screening and early prevention too. We also have on our website a blog where you can go and read more about lung cancer screening, about smoking cessation, and really how to prevent this very deadly disease. So thank you everybody for tuning in. Not sure what time. We have any more questions?
One more question?
We have a question.
Which nicotine replacement do you think is most effective?
So I'll comment on that a little bit, and then I'll pass it on to Hailey and Dr. Voelker. So there are clinical guidelines that are specified for treating tobacco dependence. The clinical guidelines state that the most effective method is dual therapy. What we have to remember is that we want to replace the amount of nicotine that people are smoking in a healthier way. So we want to make sure that we know how much you're smoking so that we can make an exact comparison and make sure that we're delivering that in the appropriate method. So the #1 best way is the dual therapy, which means usually the patch plus gum or lozenge. So the patch is 21 milligrams. It's a step-down process. You start at 21 milligrams, you can step down to 14 and then 7. But if you're smoking a pack of cigarettes a day, you're smoking between 40 and 60 milligrams of nicotine a day. So the patch alone is not going to be enough for most people to get over their cravings. That's why we recommend dual therapy. And so we add either the gum, the nicotine gum, or the nicotine lozenge. They come in 2 or 4 milligram strengths. And those can be used throughout the day to supplement when you're having a breakthrough craving, basically in place of when you were wanting to have a cigarette. And so basically you start out with that, and then over time, gradually you decrease that. You decrease the amount of gum or lozenge that you use throughout the day, and then you gradually decrease the amount of the patch from 21 to 14 to 7. So that's really the ideal therapy there. I will let Hailey and Dr. Voelker comment on that as well.
Yeah, we did the dual therapy because I'm not able to prescribe any medication, so all of our tobacco treatment specialists are allowed to do that. It's over the counter, so it's really easy. I believe it did have the highest success rate for many, many years until Chantix came out. And so I think Chantix actually is now considered the most effective. Yeah, the dual therapy, we see quite a bit of success with it. I'll have people say that they didn't really believe it, but then they put that patch on and they're like, wow, this patch really works. And of course, like you said, the gum or lozenge along with it gives you the highest success rate. And I'll let you talk about all the other meds.
Well, getting back to dual therapy, just to get an idea what that is. Okay, so you slap this patch on and it keeps this low level of nicotine in your system, but then you have a craving, right? And so that's when you take the fast-acting lozenge, lozenge, gum, nasal inhaler, or Nicotrol inhaler. Now, the lozenge works slower, the gum a little bit faster, the nasal inhaler is really fast, and as is the Nicotrol inhaler. So you get this spike. When you need that extra oomph of nicotine, you take that and you get that little bit of extra satisfaction. So that is the reason that we have this low-level patch, which helps with the general withdrawal, but when you need that extra oomph of something, that's when you take the other type of nicotine.
Right, and just to specify, so the nicotine patch, the gum, and the lozenges are all over the counter. Dr. Voelker was talking about the inhaler and the nasal spray. Those are actually prescription medications that you need to get from your doctor as well. So, I have not had haven't seen a lot of people using that because typically, it's a prescription medication for the inhaler, and there are some complaints of side effects like nasal irritation, a lot of sneezing, a lot of coughing, things like that. So For AHEC, we really focus on the patch plus the gum or the lozenge for the most effective way to help people quit.
And I will say, I've had people come in and their doctors prescribe them the inhaler. I haven't had anyone with the nasal spray yet, but they are using the patch, so they get the patch from us for free. They still get a box of the gum or something along with that, but they use the inhaler along with it. So a lot of the myth is, oh, you should only use the patch. People go, oh, is it safe to use the patch with the gum? I thought you're supposed to use one or the other. But the dual therapy, or the patch along with the inhaler, is appropriate. So there's that misconception that you should use one or the other. I don't know that Chantix would be very helpful with the patch because of the way it works with a blocker. But some people, I don't know if it's a placebo effect or what, but they'll put the patch on along with, throw everything at it. The Wellbutrin, it depends. I mean, some people I've seen great success with. I did have a client who went on Wellbutrin as an antidepressant and ended up quitting smoking accidentally. So it does work for some people, and other people it doesn't. But you can use the patch along with the Wellbutrin as well. So you can do dual therapy.
So maybe just to talk a little bit about Chantix, and just maybe Dr. Voelker can talk about this a little bit. I have patients that come in all the time and say, my cousin or my neighbor had terrible side effects on Chantix, and so, no, I don't want to take that. What kind of advice would you give somebody that came to you with that sort of comment?
Well, everybody's different, starting out with. And a lot of the side effects that people attribute to Chantix are actually side effects of smoking-cessation that increase irritability, road rage or something like that. But it's an effective medicine. Just because your cousin had a side effect with it does not necessarily mean that you will. Again, some people I've had say this medicine works miraculously, it's great, and other people say, yeah, it didn't make any difference at all. Everybody's different. Just like, however you choose to quit, everybody's different, and it's nice to be able to go to somebody who can help tailor a program for you.
Again, anybody has any questions, certainly submit them down in our Facebook page. Just wanted to again remind everybody of the resources that are listed on the back of the wall here. Again, our Gulf Coast AHEC can provide the in-person smoking cessation counseling. These are group classes, typically 2-hour-long classes. When you attend the session, you will be given the tools to quit. Develop a quit plan, and then also to your free nicotine replacement therapy. These classes are completely free. There's no expense to you whatsoever, and they're really wanting to provide these for our community to help people quit smoking. Should that be the direction that you want to head in? Certainly, we're here today on the day of the Great American Smokeout, really wanting to help people make those decisions to become smoke-free, to live a healthier life. And recognizing that it's not an easy process, and that's why we want to be able to be here to help provide support for our community members should they need it. So again, if you have any questions, please feel free to send them in. The other good website is the Tobacco Free Florida website. Again, that's the Quit Your Way program, and so they tailor an approach that's really good for you, however that may be best for you. And also to remembering that, medication and having a discussion with your physician may also be a very helpful approach as well. We were talking about the Chantix, the varenicline, or the Wellbutrin or Zyban, very effective tools to help people quit smoking. So I'm not sure where we are at with time.
11:50.
Okay, 11:50. So we have about 10 more minutes. We can kind of continue on a little bit more. I guess, Hailey, do you have any further comments, questions about really what can we do to help move people into a place of getting in a mindset for them to be ready to quit smoking?
It just really depends on the person. For some people, it's a health scare. And I'm sure you guys have seen that where, now they're ready to quit, that they're really taking that part seriously. I had one guy that was thinking about quitting, but when he found out that it could kill his dog, that was the thing for him. He said, my dog, whenever I smoke, buries his head under the covers. Is it bothering him? Is secondhand smoke something that affects an animal? And I said, yes, absolutely. Your dog is smart enough to try and get away from the smoke. And we do see pets with cancer and that sort of thing because they're a much smaller body and they do, inhale that secondhand smoke. I had someone tell me that they didn't believe the secondhand smoke was dangerous. Oh, that's ridiculous. I don't believe that if I blew smoke in your face it would make any difference. And I said, well, there's over 4,000 chemicals still in secondhand smoke and 40 cancer-causing agents. So we do know that secondhand smoke is really harmful. So for some people, it's the kids or the grandkids or, the pet or whatever. So it just really depends on who they are and what motivates them.
Yeah, so that's interesting. That secondhand smoke does actually affect your pets and their health as well. So, Dr. Voelker, do you have any finishing comments about what we can do to help people move towards being smoke-free?
Even though I've said it before, this is your journey. You have to take ownership of this. I encourage you to reach out for help and to a physician. Talk about different medications, including nicotine replacement, and then have some sort of a community, have some sort of a structured plan. I would really suggest either calling the Florida Quit Line or your local AHEC. If you call the Florida Quit Line, they'll likely refer you to AHEC too. But have some sort of support, because what happens frequently is people say, no, I'm going to tough it out. And then they get, a week or two into it, and they're having problems toughing it out, and they buckle because they have no support. So, plan this. Don't do it as a spur of the moment thing. Plan it. One of the things that, yes, people do quit smoking when they have health scares. I've had numerous patients that I tell them they've got a spot on their lung, they've got early cancer, they're starting to have emphysema, and they may quit smoking. But you know what? That sort of mantra comes back that, oh, I can only have one. Just like every alcoholic thinks, well, I can just have one drink. And as soon as you have one, that leads to the next, leads to the next, leads to a pack. So expect that. We were talking about when you first quit smoking, expect I might be irritable. Tell your family ahead of time. Look, I might be a little bit irritable. Give me a little leeway. Don't go into those situations like don't go out drinking with your friends who are all smoking. Think, well, you know what? Maybe I'll just go to the movie for the first week or so after I quit. Until I've got a better handle on this, I'm not going to put myself in those situations. If there's a situation that you used to always go, a smoke at, you went to a Thursday night card game, everybody smoking. Pass for the next 2 weeks.
So you talked a little bit about the health scares and sort of how that sometimes can be a trigger for people to quit smoking. I want you just to talk a little bit about kind of the opposite. So a lot of times, especially when people come in for lung cancer screening, they're current smokers and they come back and their CAT scan looks fine. They have no signs of early stage lung cancer and maybe no even signs of early stage emphysema. And so I always worry that gives people a license to smoke. And so I always try to encourage people that while your lungs still look really healthy, now's a really great time to quit smoking. But I think that a lot of times people, when they get a clean bill of health, oh, doc, my lungs sound great, or oh, my lungs look clear, then that means that my smoking is really not doing any damage, and it sort of gives people this license to smoke. So I want Dr. Voelker just to address that for a minute.
Yeah, absolutely. And just because you have a clean bill of health now, take that as a positive thing that now it's time to change my life. I have not changed my life. I have not done too much damage to my body. Okay, I can still get away with it. All right? Rather than waiting until your lungs are starting to dissolve. It's all part of that smoker's denial that they think that they'll be fine. And what I often hear is, well, my grandfather, he lived to 90 years old and he smoked every day. Or I've got a friend who smokes 2 packs a day and he's just fine. So much is dependent on genetics and certain factors. You are basically playing Russian roulette, okay? And the question is, because 1 out of 3 smokers will die a preventable smoking-related death. And some people even say it's 1 out of 2 smokers, right? So you're playing Russian roulette. How lucky do you feel? All right? Because the statistics are stacked, against you.
for a more personal story, I had a woman who came with her spouse, and they were both going to quit smoking. They both did end up quitting. A year later, she was back in class again. She had gone back to smoking because her spouse had gone back to smoking. He said there was something stressful that came up. He went back, she ended up going back, and she sat there very tearful because she now had COPD. She just found out that she had early stages, and she said it was this little angel on one shoulder that was telling her, quit now before it gets any worse, and feeling, depressed and feeling really, that she couldn't move like she did before, and all the rest of it, and the little devil saying, you already ruined your lungs, you might as well keep smoking. So I think that's really true for a lot of people, and I was glad that she came back to class. She was getting the nicotine replacement therapy. She did have an EAP, and I really, recommended that she take advantage of that and talk with her counselor about, the struggle that she was having with getting this diagnosis. But, it's really sad to see, so a gentleman was in the class, interestingly enough, who'd been in the class with her the year before. And he had never quit. And she looked at him and she said, don't be like me. Don't be like me where you end up with the diagnosis and it's too late. If you don't have COPD now, go ahead and quit. And so, hearing from people, we get those personal stories that it's just really sad. She really said, I wish I had stuck with it last year. I really wish that I hadn't gotten to this point.
So the message is it's never too early or too late to quit. So I just want to touch base on one other quick topic. We know that smoking is the #1 cause of preventable death. 480,000 people in a year in the United States die related to smoking-related diseases. And, I oftentimes wonder why tobacco and why tobacco dependence doesn't get the same attention as other preventable causes of death, like for instance maybe the drugs or the opiate crisis. We look at the numbers, and the numbers are staggering when it compared to deaths related to opiates and deaths related to smoking. Why is it, Dr. Voelker, do you think that smoking and this cause of preventable death doesn't get the same kind of attention that other preventable causes of death do?
Well, if you look at the way it was integrated in society, if you look back into the 40s and 30s, doctors smoked. They recommended smoking, right? So it was something that was, everybody did it. You look at Mad Men and the things in the 60s, and that was a glamorous thing to do. So, and it wasn't until we found out how bad it was for you, just a few decades ago, that it was really, we had to have this paradigm shift. And we've done a really good job at changing public opinion and educating people about the dangers of smoking. But it's sort of, we backed into it. And I think that has a lot to do with it. And that still, tobacco companies still pay a lot of money to have smoking in movies and smoking in different things to influence you, to make you think that, yeah, this is the cool thing to do.
Do you have any comments about that?
The tobacco companies have been around longer than the United States. Well, not the companies, the industry. The colony survived by selling tobacco, so it is so much a part of the culture. And for a really long time, that's their choice. It's a lifestyle option to smoke or not. And now we know, well, no, not really. And then, you can talk to people about the health issues, but we have the fact that it's psychologically addicting. And so it wasn't maybe as easy for people to quit using as people may have thought. Oh, we'll put up no smoking signs and, people will quit smoking. So I think it's a much more complicated issue than people realize.
Well, again, I want to thank everybody for joining us for our discussion. Today is the Great American Smokeout. We've been really lucky today to have Dr. Kirk Voelker here, a pulmonologist, critical care specialist, who's been a strong advocate for the past decade or more in helping people quit smoking. And then also to Hailey Shaughnessy from the Gulf Coast AHEC here, a licensed mental health counselor and a certified tobacco treatment specialist, really giving a lot of good advice about how to help you quit smoking. That's what we're here for. We want to help you along that journey that Dr. Voelker talks about in making a quit attempt and really becoming smoke-free. Again, I just want to point out the resources in the back of the screen there, the website for the Gulf Coast AHEC, and also to the Tobacco Free Florida website. Both of these organizations are willing and ready to help you quit smoking. We also have upcoming classes. We have some classes coming up here at Sarasota Memorial Hospital, the Tools to Quit classes, the 2-hour class that you can also get your free nicotine replacement therapy, and they're going to be scattered throughout Sarasota and then also into the months of December and then again in January. So if you're not ready now, maybe next month or maybe in the new year, we're going to be here to help you if that's what you choose to do. So I just want to thank our panel members, and I want to thank everybody for joining us, and good luck on your journey to become smoke-free.